it belongs to medial surface. Smooth. You never find the concha nasalis in medial surface. So in medial surface or the septum in the nasal cavity, it is smooth, and you are not able to find any concha, any projection, any bar, any opening. In this picture, I am able to show you the sphenoid sinus and the frontal sinus. Is maxillary sinus visible in this picture? No. Is ethmoidal sinus visible here? No. In this section, only I am able to show you the sphenoid sinus and frontal sinus. No fun. Tell to all of the students about the respiratory system. If any of the students has two accent, he or she is not permitted to participate in the final exam. He or she should remove and delete this block. Okay. So tell to all of the students. At the end of this class, again, I am going to read your name. If you have group, write in the group to all of them. Now, look at the picture. It is possible in your exam, I give you this picture or ask you to draw the medial surface of the nasal cavity and name all of the structure. In this picture, in the medial surface, I am able to show you the vomer bone. As you know, this green color is going to remember you the vomer bone. The vomer bone is the single bone in the skull, in the face, that it is going to participate in medial surface of nasal cavity in the septum. Posteriorly, nasal septum is going to be formed by some of the bone. Anteriorly, the cartilage are going to form the septum or medial surface. So anteriorly, here, this white color is going to remember you the cartilage, and posteriorly some of the bones. This picture is important. Which bones are going to participate? Look at here. It is the ethmoid bone. Do you remember this vertical or perpendicular plate of the ethmoid bone? This is going to participate in the posterior body framework of the septum or medial surface. So ethmoid bone is going to participate, and here the ethmoid bone is visible. This ethmoid bone, inferiorly and posteriorly, is going to make joint with the vomer. Inferiorly and anteriorly, it is going to make joint and attach to the septal cartilage. This septal cartilage is the anterior part. It consists of septum, and it consists of the cartilage. Posteriorly, the bone are going to participate. Which bone? The ethmoid bone, the vomer bone. Also, a small portion of some of the bones, such as the maxilla. We come to the maxilla. Maxilla here has a small crest. This small crest is going to participate in this medial surface. Yes, it is very small, but belong to the maxilla. So the maxilla is going to participate in the floor of the nasal cavity, in the septum or medial surface of nasal cavity, and in the lateral surface. Do you remember this picture? In this picture, I explained for you that the maxilla can participate in lateral surface. The palatine participate in lateral surface. Ethmoid participate in lateral surface. In the medial surface, again, the maxilla, a small septum, a small crest. The palatine, again, a small crest. The vomer, the ethmoid, also the sphenoid. When we head and neck, we are going to explain for you the sphenoid. We explain for you that the sphenoid anteriorly has a small crest, a small process, bony process. This bony process belongs to the sphenoid. So sphenoid, ethmoid, vomer, a crest that belongs to the palatine, a crest that belongs to the maxilla, and here anteriorly, the septal cartilage are going to participate. Again, a spine of the frontal bone, the spine of the frontal bone, and the mid part of the nasal bone. This nasal bone anteriorly also are going to participate a small portion in medial surface of the nasal cavity. So the nasal bone, the spine process of the frontal bone, ethmoid, vomer, crest of the maxilla, crest of the palatine, and the sphenoid are going to participate in medial surface of the frontal nasal cavity, in the nasal cavity. This picture is going to remember you that the medial surface consists of which structure. Look at the picture. Here, the ethmoid bone is visible, vomer bone, the crest of palatine, the crest of maxillary, sphenoid bone, and anteriorly, the spine of the frontal, the nasal bone, and here is the septal cartilage. To be able to remember, again, I draw this picture here. It is the lateral surface, the medial surface. Remember this picture. Here, if you imagine, you can imagine that here is the ethmoid, here is the vomer, here you can find the sphenoid. It is a crest of the palatine, a crest of the maxillary, a spine of the frontal bone, and the nasal bone. They are going to participate in medial surface of the nasal cavity. Do you get that? Medial surface is easy. Now here, in which view you are going to look at your skull?
Inferior.
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 You are going to look at the inferior surface of the skull. In the dissection room, if I give you the skull, you can rotate and find this picture, this view. Here, you are going to look at the superior alveolar bone. And this is going to show you the roof of the oral cavity. The roof of the oral cavity is which part of the nasal cavity? Floor of the nasal cavity. Anteriorly, the maxilla is going to fall and participate, and posteriorly, the horizontal plate of the palatine bone are going to participate. In this picture, exactly posterior to the incisive tips, posterior to the incisive tips, you can find a foramen we call incisive canal. Incisive canal is a foramen in the roof of the oral cavity, exactly posterior to the central incisive tips. Here I am able to show you the choana. Do you remember the choana is the name of the posterior opening of nasal cavity? Here you are going to look at the posterior opening of the nasal cavity. So this bone, this purple color is going to remember you the vomer. Vomer is the bony structure, bony framework of the septal nasal cavity. If you look at the choana, choana is the name, the spatial name of posterior aperture or posterior opening of nasal cavity. It is inverse, means in anatomical position, here is inferiorly and here is superiorly. But I rotate. So everything changed. Can you imagine? In anatomical position, the choana, the posterior opening, are in the back. And this picture rotates. So here is going to remember, in this picture, then I am going to explain for you the choana. Here is superiorly, but in anatomical position, in real, here is inferior. Do you get that? I rotate. Means, imagine, here we have an opening. In this picture, I rotate. So the inferior go up, the superior come down. Hello? This is the roof of the oral cavity. The roof of the oral cavity. Okay? To be able to show you this picture, I rotate. So everything changed. If in this picture it is superior, it is inferior. But in real, here is inferior, it is superior. Okay? Can you imagine? Now, you know this picture? Yes?
Yes.
I'm not going to ask you again. It's better tonight go and read by yourself to get in your mind, because you should be sure that some of the questions are going to prepare for you about the middle meatus that I explained for you today, about the superior meatus that I'm going to explain for you today. So please read carefully this session. I explained all of this. Now I come back here. It is the choana or posterior aperture, posterior opening of the nasal cavity. This nasal cavity in the medial surface is going to be formed by the vomer. This picture I magnified here. It is vomer. This choana inferiorly are going to be formed by posterior border of the horizontal plate of the palatine bone. It is palatine bone. This is horizontal plate. And here is posterior border of horizontal plate. So posterior border of horizontal plate is visible here. This picture is in anatomical position, and this picture will rotate. So in this picture, the posterior border of the horizontal plate of the palatine bone is superiorly, but normally in anatomical position, the posterior border of the palatine is going to form the inferior boundary of this choana. Okay?
Okay.
Yes?
Could you explain that again?
I told you, it is anatomical position. In anatomical position, the floor of the nasal cavity is going to form the roof of the oral cavity. So the posterior bone that participates in the floor of the nasal cavity is palatine. Now in this picture we rotate. This palatine bone come here. This palatine bone, I put this picture to be able to show you that the palatine, the horizontal plate of the palatine posteriorly is going to form the inferior boundary of the choana. Can you imagine? The medial surface of the choana is going to be formed by the vomer. The inferior, look at here, the inferior, I told you, is going to be formed by the palatine. The medial is going to be formed by the vomer. And the superior of this choana means here. The superior boundary of the choana is going to be formed by the ala of the vomer. Means it is vomer. This vomer superiorly divides into process. So here is the roof of the choana. Small portion of the roof of the choana is going to form by the ala of the vomer. Vomer is going to participate in the medial septum, medial surface, and a small portion in the roof in your exam. I never ask you what's the name of this bone. What's the name of this bone? Bone. It is easy. In your exam, it is possible. I prepare a question for you. Which of the following bones are going to participate in the medial septum or medial surface of nasal cavity, bones, and the roof? Bone. Which of the following bone is going to participate in the inferior surface of the corona and lateral surface of the corona? Or you should remember another one. So I'm going to prepare questions such as this. Now look at here. It is the anatomical position. The medial surface, vomer. The roof, a small portion of the vomer. What's the name of this small portion? Ala of the vomer. Another bone that participates in the superior boundary of the corona is a vaginal process that belongs to the trigoid process. The trigoid process has the palatine has a vaginal a process. So superiorly, you can find the sphenoid and palatine bone. Superiorly, you can find the sphenoid and palatine bone. The laterally, you can find the medial surface of the medial plate of trigoid process. I'm going to explain this corner again. Look at here in your book, you find everything. In this picture, you are going to find medially the corona is going to be formed by the vomer. Inferiorly by the posterior border of the palatine bone. Laterally by the medial plate of the trigoid process. And superiorly, it is going to be formed by the vomer. Which part of the vomer? Ala. And also remember only sphenoid. That's enough for you. So superiorly remember the sphenoid and the ala of the vomer. Okay? Medially vomer. Inferiorly palatine. Laterally medial plate of trigoid process. Superiorly, please remember the vomer and the sphenoid. That's okay for you. Okay?
Naturally, we medial plate of trigoid.
Medial plate of trigoid process. Again, medial plate of trigoid process belong to the sphenoid. Okay? Now, here, I come back to this picture again. Coronal section of the nasal cavity. If it is possible, I ask you which of the following bone is going to participate in the lateral surface, in the roof, and medial surface of the nasal cavity. Which bone? S-bone. Which bone is going to participate in the inferior surface of nasal cavity, in the septal surface of nasal cavity? Maxilla and palate. Okay? And which of the bone are going to participate in lateral surface and in the floor? The palatine, the maxilla, okay? All of this bone part. Is lacrimal bone participate in lateral surface? Remember that? Yes. Is sphenoid or trigoid process participate in lateral surface? Yes. Remember this picture. This picture. Is ethmoid bone participate in lateral surface? Yes. Is conchanasalis inferior participate? Yes. Is nasal bone participate in lateral surface? Yes. So please remember this picture, read more and repeat to get in your mind. Now about some of the opening in the nasal cavity. Please look at the picture. All of these pictures I uploaded in the Navi system and they have voice. You'll be present in the class today. Tonight, please Listen to the nervous system voice. I know that it is difficult to get in your mind everything tonight, but please listen to the nervous system, all the things that I explained for you. It helps to you that today, 2 times, you read all of the anatomy about the nasal cavity. It helps to you to get in your mind.
The slide above, we don't have it for the navigons.
I prepared all of this picture from the nervous system. So you are going to find all of this in nervous system. And the name is artery, okay, respiratory artery. Now in this picture, you know the nasal cavity has 2 openings. Two of them is visible to you. The nose reed anteriorly, the corona posteriorly. In lateral surface of the nasal cavity, in the superior meatus, we have here, it was one of the questions in the last semester. In superior meatus, posteriorly, superior meatus, visible in lateral surface. Posteriorly, I am able to show you a large foramen. The name of this foramen is sphenopalatine foramen. Sphenopalatine foramen. The maxillary artery, the branch from the maxillary artery, the branch from the maxillary nerve are passing through this foramen. This sphenopalatine foramen connects the nasal cavity to a small fossa that we call petricopalatine fossa. So this foramen is connection between the petricopalatine fossa and nasal cavity. You know the nasal cavity? This nasal cavity has connection to a small fossa, to a small area. This small fossa we call petricopalatine fossa. This sphenopalatine foramen is a connection between the petricopalatine fossa and the nasal cavity. In which part of the meatus you are able to find the sphenopalatine foramen?
Medial.
In superior meatus, posteriorly. In superior meatus, posterior, the sphenopalatine foramen is visible. If you look at this picture, it is the sphenoid sinus. The opening of sphenoid recess is going to open to the sphenoethmoidal recess. Sphenoethmoidal recess. Here is going to remember you the roof of the nasal cavity. The roof of the nasal cavity. In the roof of the nasal cavity, here is cribriform, means you can find so many foramen. From this foramen, the axon of the olfactory epithelium are passing. Axon of the olfactory epithelium are passing. Also, you can find another foramen, a spatial foramen for passing of the ethmoidal, anterior ethmoidal neurovascular structure, anterior ethmoidal neurovascular vessel are passing here. And cribriform foramen. From this cribriform foramen, you can find the axon of the olfactory epithelium pass. Also, the posterior ethmoidal artery to be able to access, to come inside of the nasal cavity, pass through this foramen. So the anterior ethmoidal artery and anterior ethmoidal vein and anterior ethmoidal nerve. The axon of olfactory epithelium, the posterior ethmoidal vessel, not nerve, are coming inside of the nasal cavity. One of the questions for the last semester was about this. I don't exactly remember the stem of the question, but the stem of the question was something such as this. All of the following items are visible inside of the nasal cavity except anterior ethmoidal artery.
Yes.
Yes. Anterior ethmoidal vein. Yes.
Yes.
Anterior ethmoidal nerve. Yes.
Yes.
Posterior ethmoidal vessel. Yes.
Yes.
Posterior ethmoidal nerve?
No.
The posterior ethmoidal nerve never pass and enter to the nasal cavity. So I explain for you. Roof of the nasal cavity is visible here. Here is cribriform, means you can find so many foramen. Which structure are passing through this foramen? You can imagine that the axon of the olfactory epithelium are passing the ethmoidal, posterior ethmoidal vessel, not nerve, the anterior ethmoidal vessel and the nerve, and also here is the crystal body. Do you remember the crystal body?
Yes.
It is the superior portion of the vertical or perpendicular plate of the ethmoid bone. Now, anterior to crystal body, you can find a foramen. From this foramen, the accessory vein is passing. It is going to connect the nasal cavity to cranial cavity. It is a pass, it is a way that the infection can spread to the cranial cavity through this way. Okay? Now, here, about the artery, this picture is going to remember you. Which artery are visible in medial surface and which artery is visible in lateral surface. Look at the picture. This picture is going to help to remember and get in your mind easily. The blood supply of the nose, medial surface, lateral surface. In the medial surface and lateral surface, which artery are visible? If you notice in this picture, you can find that sphenopalatine artery is passing through the sphenopalatine foramen. Sphenopalatine artery is the terminal branch that belongs to the maxillary artery. The terminal branch that belongs to maxillary artery. The external carotid and internal carotid, both of them are going to have some branch in the nasal cavity. Do you remember the heart?
Yes.
Really, you remember?
Yeah.
Okay.
Also.
Look at here. Here we have the heart. Okay? The ascending aorta, arm of the aorta. What's the name of the first branch? Where I took separate from. What's the name of the second branch?
Common carotid.
Okay, left common carotid. Yes? Left common carotid, right common carotid. Look at the picture. The left and right common carotid go up in half of the neck and divide to two branches. Medial carotid and
Lateral.
internal carotid and external carotid. So the common carotid go up, ascend, and divide to two branches. External carotid and internal carotid. Internal carotid never has any branch in the neck. A foramen in each side of the skull, in inferior surface, is going from passing from this foramen and enter to the cranial cavity. So the internal carotid is responsible to supply the brain and to the organs. The internal carotid is one of the terminal branch from the common carotid. The internal carotid leave the neck without having any branch to be able to access, to enter to the skull, used from a foramen in the base of the skull. This foramen we call the carotid foramen. This carotid foramen is the foramen for passing of the internal carotid artery. It is going inside of the skull to supply which part?
The
Brain and the orbit. All of the structure in the orbit. What about the external carotid? External carotid has 8 branch. The external carotid has 8 branch in the face and in the neck. We call external carotid. So have 8 branch. For example, one of them goes to the tongue. One of them, for example, go to the face. We call facial artery. We call lingual artery. And one of them we call maxillary artery. This maxillary artery in each side go to the sphenopalatine foramen and go toward to sphenopalatine foramen. Before reaching the sphenopalatine foramen has so many branches. The terminal branch that belong to the maxillary and pass through the sphenopalatine foramen we call the sphenopalatine artery. Do you get that?
Yes. Yes.
Okay, you. What's your name? Hasani? Yes. You explain what I explained for you.
No, it's talking about the blood supply of the nose.
Huh?
Blood supply of the nose.
Who is ready?
A bit.
You.
A little. So the carotid arteries in general, while going to the head, they will divide into internal and external. And the internal, it will go into the skull and it will supply the brain.
Only brain.
And the
all of the structural content of the organ. Okay?
The organ?
Eyeball.
What's it called? What you just said.
Ophthalmic, the internal carotid go inside of the skull, supply the brain, and also all of the content of the orbit.
Orbit?
Orbit. Eye.
Okay,
This
okay.
whole side that your eye is here, eyeball is here, need to be supplied. Which artery is responsible to supply
Internal
all the
carotid.
internal? What about the external
External carotid, it supplies, has 8 branches.
In the neck.
It's in the neck and in the face. And it supplies the tongue and the neck and tongue and mouth, and also the nose. In the nose, it
one of the branch we call magnet. One of these 8 we call
maxillary.
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 Maxillary has so many branches. The end branch, the terminal branch,
Is the
sphenopalatine
branch.
because it is passing through the sphenopalatine foramen. When the sphenopalatine, thank you. When the sphenopalatine branch passes through the sphenopalatine foramen, enter to the nasal cavity. Has some branch for the lateral surface, has some branch for the medial surface. Okay? So sphenopalatine is going to be found in medial surface of the nasal cavity and also in the lateral surface of the nasal cavity. Has some branch.
That's for the maxillary.
From the maxillary. From the ophthalmic, the internal carotid inside of the brain, inside of the skull, supply the brain and has a branch that we call ophthalmic branch. This ophthalmic branch go to the eyeball, go to the orbit. From the ophthalmic artery, we have so many branches. From the ophthalmic artery that belong to the internal carotid, we have so many branches. One of them we call the anterior ethmoidal, one of them we call posterior ethmoidal. Anterior ethmoidal, posterior ethmoidal belong to ophthalmic and ophthalmic belong to internal carotid artery.
So in both internal and external supply.
Internal carotid and external carotid, both of them has branch for the nasal cavity. The anterior ethmoidal, posterior ethmoidal belong to the ophthalmic belong to the internal carotid. The anterior ethmoidal and posterior ethmoidal are going to enter to the lateral surface and also to the medial surface. So in medial surface, look at this picture, you have a branch that belongs to the maxillary, belongs to the sphenopalatine artery, has a branch that belongs to anterior ethmoidal, a branch that belongs to the posterior ethmoidal. Okay? In lateral surface, anterior ethmoidal, posterior ethmoidal, and a branch that we call sphenopalatine. This sphenopalatine has some branch for the lateral surface. We get that? Now, What's the name of this artery that belongs to external carotid? Go to the medial surface of the eye. We call facial artery. Facial artery. This facial artery is going toward to the medial angle of the orbit. Has some branch for the nasal cavity, some branch for the oral cavity, for the lip. For the nasal cavity, some branch from the facial artery are going to enter to the lateral surface from the nostril. From the nostril, they pass to be able to access to the lateral surface, and also they are going to access to the medial surface. Another branch that belongs to the maxillary artery here, before coming and passing through the sternopalatal foramen, from the maxillary artery, you have a greater palatine artery. This greater palatine artery is descend. This greater palatine artery descend, and here inferiorly enter to the roof of the oral cavity. This greater palatine go anteriorly, pass through the incisive canal to be able to access, pass through the incisive canal to be able to access to the medial surface of the nasal cavity. So in medial surface of nasal cavity, you can find a Kisselbach area or plexus. This Kisselbach plexus is going to show you an area that it is possible that breathing is going to happen here. Which artery are going to make this plexus? The anterior ethmoidal, sometimes the posterior ethmoidal, the branch that belongs to sternopalatal, and also the greater palatine are going to participate. And here you can find some superior alveolar artery. So some superior alveolar artery that belong to facial, the greater palatine, the anterior and posterior ethmoidal, and the medial or some of the branch that belong to sternopalatal are going to make this Kisselbach plexus. This Kisselbach is going to be visible in which surface of the nasal cavity, lateral or medial?
Medial.
Medial. In medial, it is important. This plexus, sometimes it is possible that you have blood coming out here, okay? Belong to this Kisselbach plexus. Which artery are going to form this Kisselbach artery, this area? Anterior ethmoidal, posterior ethmoidal, the greater palatine, and the sternopalatal, and the superior alveolar.
Khanum, the great palatine comes from the external one.
Look at it. The greater palatine artery belong to maxillary artery. Before passing, the name changed to sternopalatal. I told you has so many branches. One of them is called greater palatine. It is important. The greater palatine, look at the picture, is passing from a canal in lateral surface of the nasal cavity, come down. And here is the roof of the oral cavity, posterior to the roof. Here, you can find a foramen. This foramen is for passing of the greater palatine artery. Here it's entered to the oral cavity. In the roof of the oral cavity, go anteriorly to be able to reach to the nasal cavity, pass from this incisive canal. When I say incisive canal, I told you it is posterior to incisive teeth. Okay? Incisive teeth, we have how many incisive we have in each alveolar bone? 4. 4 incisive, what's the name of this teeth? Canine. So 4 incisive teeth we have in each alveolar bone. Posterior to the superior incisive teeth, you can find in the roof of the oral cavity, you can find one foramen. If you imagine, here is the roof of the oral cavity, and here is the incisive sits. Posterior to this, you have a foramen. This foramen belongs to incisive channel. This incisive channel superiorly divides to two. So if here is the septum of the nasal cavity, each side of the nasal cavity, each side of the nasal cavity you can find a foramen. Okay, here is the roof of the nasal, the oral cavity, and here is the roof of the oral cavity, here is the floor of the nasal cavity. In floor of the nasal cavity you can find a foramen in each side. Inferiorly only one foramen. You get that?
Yes.
So here in the oral cavity we have one foramen, superiorly divide for each nasal cavity another one foramen, because superiorly divide but inferiorly only we have one foramen. Which structure is passing from this incisive channel? From the oral cavity to the nasal cavity, the greater palatine artery. Later, I'm going to tell you that from the nasal cavity to the oral cavity, a nerve is passing. So, incisive canal is for passing an artery and a nerve. This artery, if you imagine, here is the oral cavity and here is the nasal cavity. This artery is going to leave the oral cavity to be able to access to the nasal cavity. What's the name of this artery? Greater palatine artery. And from the nasal cavity to the oral cavity, a nerve is passing. Later, very soon, I am going to give you a name of the nerve. It is leaving the nasal cavity to access to the oral cavity. We get this picture. Do you have any question about this picture? I'm going to explain again. Some of the artery enter to the nasal cavity to be able to stop blood. Lateral surface, nasal surface. Lateral surface is visible in this picture. Medial surface or the septum of the nasal cavity is visible here. In lateral surface, if we look at to the superior microscope posteriorly, I am able to show you a foramen. The name of this foramen is sphenopalatine foramen. From this foramen that we call sphenopalatine foramen, an artery that we call the sphenopalatine artery is passing. The sphenopalatine artery is the terminal branch of the maxillary artery. Maxillary artery belongs to external carotid artery. Okay? Now, the sphenopalatine artery enters to the nasal cavity, has some branch for lateral surface, has some branch for the medial surface. Internal carotid artery, inside of the skull, has a branch that we call the ophthalmic artery. This ophthalmic artery has so many branches. One of the branch we call anterior ethmoidal, one of the artery we call posterior ethmoidal. The anterior ethmoidal and posterior ethmoidal pass through the roof of the nasal cavity to be able to access to the lateral surface and goes to the medial surface. So anterior ethmoidal and posterior ethmoidal has branch for the medial surface and for lateral surface. The sphenopalatine again has branch for the lateral surface and for the medial surface. The maxillary artery has so many branches. Another branch before the sphenopalatine we call greater palatine. The greater palatine in the lateral surface of nasal cavity come down, enter to the oral cavity, and in the roof of the oral cavity go anteriorly to be able to access to the nasal cavity used from the incisive canal. After passing through the incisive canal, enter to the medial surface. In medial surface is going to participate to Kisselbach plexus. In the Kisselbach plexus, the anterior ethmoidal, posterior ethmoidal, sphenopalatine, and also greater palatine, and also some branch that we call the superior alveolar are going to participate. Okay? Now, here again, With the another picture, we are going to show you the lateral surface, the medial surface. Now in detail, we explain that the sphenopalatine has some branch that we call, for example, some branch here, that we call the post-row superior lateral, the post-row inferior lateral. This is in detail. Only you know something that I explained for you in the last slide. Now, here, again, you are going to look at the maxillary artery. It is the sphenopalatine artery. It is the
Great.
greater palatine. It is passing through the oral cavity to access to the medial surface, pass from the incisive.
Canal.
Okay. Now,